Hey, how's it going? In this video, I will be going over how big data can achieve SDG 3. Now, to start off with, I would like to go over what SDG 3 is. It's defined by the UN as ensuring healthy lives and promoting well being for all at all ages. The UN has defined 13 targets for SDG to judge the progress that we've made. Uh, the first is reduce maternal mortality. The next is end all preventable deaths under 5 years of age, to fight communicable diseases, reduce mortality from non-communicable diseases, and promote mental health, prevent and treat substance abuse, reduce road injuries and deaths, universal access to sexual and reproductive care, family planning, and education, achieve universal health coverage, reduce illnesses and deaths from hazardous chemicals and pollution, implement the World Health Organization Framework Convention on Tobacco Control, support research, development and universal access to affordable vaccines and medicines, increase health financing and support health workforce in developing countries, and finally, improve early warning systems for global health risks. Next, I'd like to go over just a little bit of the data. The exact data that we're looking at today is going to be the mortality from non-communicable diseases, and this data is from 2019. Non-communicable diseases, or at least the ones that are gone over in this map, are CVD, cancer, diabetes, or CRD. So that's chronic respiratory disease. And if you look there, you'll see that there's still a very high mortality rate throughout the entire world, and there's a lot of progress that we have to make towards that. Um, the next graph that I want to look at shows the same thing, but it shows it over time, and I picked out a couple continents or specific regions in a continent. There weren't any for South America, so I took Brazil. I looked, and all of those numbers were about median in Brazil. So as you can see, there's still an extremely high rate of mortality from these non-communicable diseases, especially in South Asia, Sub-Saharan Africa, and Middle East and North Africa. These are all things that we have to pay attention to, and as you can see from this chart here, all of these numbers have gotten better as these SDG goals have been implemented into the UN. So, what exactly is big data? Um, Big data is extremely large data sets that may be analyzed computationally to reveal patterns, trends, and associations, especially relating to human behavior and interactions. Now, how exactly can this be applied to help achieve Sustainable Development Goal 3? Um, so, first off, these large data sets will have more extensive family history so that your doctor will be able to better diagnose you based off of not only your history, but the history of your family and what diseases you may be perceptive to. Biomarkers is another way that it can help. These biomarkers will be taken from just heaps and heaps of data to address some things that are early warning signs for some of these diseases, and your doctor will be able to let you know so you can address these sooner and have a much better chance of surviving. Next is the transfer of medical history. Whenever all of your history is in the cloud, it's a lot easier to send to another hospital if you're having to change hospitals or change doctors. Also, having all of these files in the cloud allows for hospitals to have a greater capacity, which will allow them to serve more people. And finally, overall, this data will this data increases the quality of life and allows people to relax more, which can help with diabetes and other some of those other non-communicable diseases. They're more manageable, not avoidable, but they're much more manageable if your quality of life is higher. Now, finally, I'd like to say for more information, please visit sdg-tracker.org/good-health.